With regards to recovering from the Brazilian butt lift, number one, the reason for staying off your buttocks for the first week absolutely is to make sure that as much of the graft survives. After the first week, limited amounts of sitting are allowed, and the reason we don't want you doing very much of it is one, you will be sore, and two, you want the maximal survival of the fat, because this is unpredictable. The surgeon cannot control how much of that fat survives. It's an individual process, so from one patient to the next you can see variable amounts of survival. So if you want to ensure that you have the best chance of getting the result you want, then you follow these instructions. By the end of 6 weeks, you can pretty much sit and lie on your buttocks to your heart's content. As far as recovery to get to work, most patients at 1 week feel well enough to resume most of their activities. By 2 weeks, they can even start going to the gym. And certainly by 1 month, they're pretty much recovered. However, when are you going to see, quote unquote, the final result? Well, a preliminary final result is about 1 month, and the reason is simple. It'll take about a month for most of the swelling from the liposuction to have subsided, and it will take about a month for any fat that did not survive to be reabsorbed by the body. After the first month, you will still see some further changes, but they're not as dramatic. However, realistically speaking, if you want to compare your before and afters, you wait approximately 6 months and you use your preoperative photographs and your 6-month photographs and use a comparison, and that's when you can really tell how much of the fat graft survived. So what I always tell the patients is do not fall in love with your butt at 1 week, because if you like that size, chances are you'll be disappointed when you get to 4 weeks because it will have gone down some. Realistically, 1 month is when you can see the general volume that you're going to maintain.